My name is Freddy and I'm a chartered human physiotherapist and I also treat horses. I have recorded 8 video clips with simple exercises 3 years ago. They are on my video channel. Some of you will have seen them, others won't. And I think it's about time for follow-up. Here we've got the front view of the adductor muscles, the ones that basically bring your legs together. Again, here's the pelvis, the front view. This is your hip joint, the top of the femur. Here's the knee, kneecap, this one. And here's the pubic bone, the part of the pelvis. And down there is your sitting bone, but that's from behind. So this is further back and it's basically superimposed here. And the muscle attachments that we're seeing here of the adductor muscles go to the pubic bone, not to this part here. So you can see there are quite a few different ones. I don't want to name them all, but you can see that this is the gracilis here. Again, some of them go, as you can see here, below the knee. This is the gracilis going down there. And so they give the inside of the thigh the shape. And yeah, basically very important again to keep you connected to the horse. But they're also the ones that might make you squeeze the horse a little bit too hard if you're not careful. And they can get very, very tight over time. I will read a bit to you now about creep that I found in Wikipedia. And it says, in material science, creep, which is sometimes called cold flow, is the tendency of a solid material to move slowly or deform permanently under the influence of mechanical stresses. It can occur as a result of long-term exposure to high levels of stress that are still below the yield strength, which is the breaking point, of the material. The rate of deformation is a function of the material properties, exposure time, exposure temperature, and the applied structural load. Depending on the magnitude of the applied stress and its duration, the deformation may become so large that a component, which is talking about material science, can no longer perform its function, or in human bodies, it would be, for example, a rupture of a tendon or a ligament, or maybe even the disc. Human soft tissue is highly deformable and its mechanical properties vary from one person to another. We see that in that some people are more stretchable than others. Generally, women are more flexible than men. Soft tissues have the potential to experience big deformation, and they will still come back to their initial state or configuration when they are unloaded again. And some of the properties that we can observe in soft tissues are relaxation, creep, and hysteresis. If spinal disc material is continuously overstretched and the disc material starts to bulge, and I'm talking about years of cumulative abuse of these tissues, then the breaking point or the yield strength of the disc will be achieved at some point, and you get a disc bulge or disc rupture or something like that. However, we have to differentiate between abuse and specific stretching techniques. In my exercise section, I'm suggesting a stretch that is longer than 30 seconds to make use of the creep properties of soft tissues. Also, when myofascial release techniques are taught, specific techniques to make an inroad into particularly tight fascia require holds of 3 minutes or more. Hysteresis is the property of a tissue to retreat gradually back to its original state after it has been deformed. And this is why I think it's quite important to do stretches quite regularly, because a while after you have stretched and you stop stretching, your tissues will go back to their original state. So I think little but often is usually the word. Having said that, I have improved my body quite significantly, or the stretchability of my body quite significantly, even just by doing some exercises once or twice a week. I want to talk about ice a little bit now, and what I really want to do is get people to think about what they're doing when they're using ice on their own injuries or on their horse's injuries. I'm sure most of you have spent a lot of time cold hosing their horse's legs when they've had a leg injury, a tendon strain or something like that. And I just want to throw a few things out into the public here. When I first started to study physiotherapy quite a long time ago, ice was recommended as part of treatment, especially if the patients had a lot of pain or swelling post-operatively or after an injury. And I have never been really a fan of it. And once I qualified, I don't think I ever really used it. I can't really remember that I used it. I'm not saying don't use it for a fresh injury. You've got a fresh ankle sprain or whatever on the playing field, bang, boom, you put the stuff on. It's okay. I think there is some value in it, but it must be done immediately. I think even half an hour after the injury has occurred, I think it's too late. Just think about what we're doing, because imagine you've got a bit of meat, and if you want to keep it fresh, you put it into the fridge or into the freezer, because it slows down the metabolism of the bacteria. So they get, I don't know, frozen as well, or, you know, so their metabolism slows down or stops altogether, and the meat stays fresh longer. So if we put ice on a fresh injury, aren't we slowing down our local metabolism of the cells as well? And do we want to slow down metabolism in a fresh injury? That's when everything has to happen. Inflammation is the first stage of healing. We need inflammation, because the blood vessels widen, and they bring in all the blood or all the stuff that is needed for the healing. So why do we want to cool it down to slow it down? I personally don't get it. The other thing is also physios quite often, after knee replacements, for example, use a drop and dangle technique, where the patient is asked to hang the knee over the edge of the bed and let the lower leg dangle down. They're told to do this maybe 10 or 15 minutes to make use of the creep. Cool, but then they put ice on it. Now, if you remember what I said earlier, part of the properties of creep is that the temperature is important, and actually when we cool it down, it actually inhibits creep. Creep works better at higher temperatures. So why do we want to drop and dangle the injured tissue over the edge of the bed to make use of the creep, and then we put ice on, which inhibits the creep? I don't get it. Also, someone did a study, I don't know, in the 1980s or something, that said that the benefits of stretching longer than 30 seconds are basically zero. There's no extra gain in stretching longer than 30 seconds. Now, if that was true, that would basically say that creep, which says the longer we stretch, or as long as we stretch, the tissues will still deform and stretch, that would be untrue. So I just thought I wanted to throw all this in here so you can then, if you want to, make your own decisions about how you want to go about stretching and the injuries. But I also want to say some of my stretches are actually significantly longer than 30 seconds. I hope that you can follow my reasoning and understand what I'm saying here. Lisa has her own personal little challenge because she's supposed to be doing the splits at some point. And I think this might help her a little bit. So we're doing a prolonged adductor stretch now, and I don't know, is that as far as you will go? Yeah, that. So that, okay. And the things that I do for myself when I do it is if you just sit up straight, hold straight, put your hands here, nice and tall and straight, and now do side bending. And ideally you want to see that you get your arms down, your elbows down to there, and down to there. So I usually start with that just as a little warm up. Okay, the next thing that you can do while you're there is you can do a little self manipulation of the soft tissues of the adductors there, like so, and just go up and down the leg a couple of times like this. Do your leg. And then I get people, or I get myself to do this, so I reach forward there. See if you can reach with your left hand to your right foot, and then you slowly move across there. Do that there, that's it. And then just, yeah, hold it down. Go over to the other side again. And go into the middle and see if you can stay there. And the idea is, wherever you do, probably better for you back to support yourself if you can't go all the way down. The idea here is to hold the adductor stretch for quite a few minutes. And what you do with your body, essentially any of these things are just giving you a variety of stuff to do as long as you hold the stretch. The other thing that I also do is bring your foot up a bit. I myself roll my leg out like this. So if you just come here and just maybe hold your, if you hold it by the foot or by the ankle, and then you can tweak it out and you come a bit closer to here with the other arm. Yeah, and just roll it out. Don't move your hand, just you get a good angle here. Do the other one, come down there, roll the leg out a little bit so it doesn't flop inwards all the time when you do the stretch. And then you can change it to where you go a bit further down over there with the arm and still roll it out if you want. So yeah. And then you can see if you can move forward a bit but still roll it out with the other hand. Change sides. There, roll it out. Bring your arm, this arm there. Okay, and then go forward a bit, but still keep it out there. Yeah. And have a rest. Okay, the first thing is these moves again. I don't show them from close up now. To show all the different positions that I get myself into to do the stretch.